This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Is there a DPC clinician, tech vendor, or industry champion that goes above and beyond to further elevate the DPC movement? Nominate them for a DPC Innovation Award to recognize them for creating traction, embracing innovation, and demonstrating commitment to the movement. DPC Innovation Award winners will be announced and honored at this year's Hint Summit, taking place in Denver, Colorado, September 27th through 28th. Nominate a DPC innovator at summit.hint.com, plus get $50 off your Hint Summit 2024 registration with promo code MyDPCStory. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, patients pay their doctor a low monthly membership and, in return, build a lasting relationship with their doctor and have their doctor available at their fingertips.
Direct care has given me a chance to truly create healthy humans, one patient at a time, by utilizing my osteopathic medical training as well as offering the time that is needed to reach humans on an individualized and personal level. I am Dr. Amber Beckenhauer of the Healthy Human DPC, and this is my DPC story.
Dr. Beckenhauer is known by almost all of her patients as Dr. B. She grew up in the small town of Ashland, Nebraska, where she now has a second location. She completed her medical degree at KCUMB in Kansas City, Missouri from 2004 to 2008 and finished family practice residency in Lincoln, Nebraska in 2011. In July of 2011, she moved to Blair with her family to begin employment at MCH and Health System. From 2011 to 2017, she not only practiced primary care at the clinic for all ages, but also delivered infants by vaginal and cesarean methods, staffed the emergency room, served as medical director of the ER and Blair Clinic, and lastly served as medical staff president before her departure. From 2018 on, she continues to help the local hospital by working in the ER and delivering babies vaginally and by C-section. Dr. Beckenhauer enjoys teaching family practice residents in her spare time and started at Nebraska Medicine Clarkson Family Residency Program in the fall of 2018 to help promote the education of rural family practice doctors. With her osteopathic medicine background, whole person healthcare resonates with her. It also drives her passion for integrative wellness and hormonal balance. To further her studies, she has completed courses for the American Academy of Anti-Aging Medicine. Dr. Beckenhauer believes that passion starts with people, and we can all make a difference, one patient and person at a time. Welcome to the podcast, Dr. B.
Hey, how are you, Marielle?
Doing well. I wish I could see you in person to do this, but thank you so much for joining today.
You're calling me in your most favorite place ever, Nebraska.
This is true. It is very true. For those of you who don't know that I went to Creighton, Nebraska has a extremely special place in my heart.
She wants to say it's her home, but she won't admit it. It's all right. It's all right. Nebraska's not for everyone.
I wanted to start off with the beginning of your clinic and the beginning of your story, because you created your clinic and your brainchild the year before you opened. Can you share the details of that story with us, please?
Yeah. As physicians, we have an extremely full plate all the time, right? But some of us, I think we're just always thinking about ways we can, just find some downtime and help people in different ways. And make it almost fun in medicine, right? At least that's how we used to think before we became direct primary care physicians, like how to incorporate all that excitement back into the everyday mix instead of all these algorithms and insurance and all these different hoops we have to jump through. And actually, my husband and I had been at an Eric Church concert and just walking in downtown Lincoln and doing a lot of talking. And we had talked about opening up a business on the side, actually more from like an IV standpoint, because I do love to run. And I wanted to work with athletes a little bit more and help them with their training and recovery. And that's really where it started, just him and I downtown walking after a concert and having a weekend away. And as I delved into that on Facebook and tried to find out, how I would add something more to my already 120-hour week and 3 children, I came across a couple posts on Facebook from a private practice physician group just saying, I think what you're asking about is really a cash pay practice. And at that time, I guess that really is what I was asking about. But I was just thinking about one aspect of it. I got let into the direct primary care physician groups. They let anybody in there if they let me through that door. So I really appreciate having that opportunity, because here I am now. They didn't know who they were letting in, but I got in there and started reading all these stories, and I'm like, holy cow, these people are talking about like true family practice medicine on a whole new level of what I was thinking. And now I'm starting to wonder, is this really the path that God was leading me down? Did I really not want to start potentially a side business on top of my already busy, really week to get away and kind of have my own time? Or did I really want to actually really get away from the rat race I was in and just move to this model completely? And I didn't know what that meant to me, but I read a lot of posts and I saw a lot of people on there, and I saw that a lot of them were in the Midwest. And so after like I'd say almost a full year, because that concert was in like January timeframe, and we're talking by October of the end of that year, I think I had talked myself in and out of direct primary care probably 6 to 7 times, as my husband's kind of doing the eye roll in our living room. Like, I don't know how many times I have to tell you that, you will do fine. So he was really my silent cheerleader at times. And sometimes he was like trying to just push me off the cliff to jump already. But I decided to take my oldest son, Jackson, with me and jump in the car. And over his fall break in October, we decided to take a drive down to good old heartland of the United States, Kansas, and stop in and see now a good friend of mine, Dr. Vance Lassie, another good friend, Dr. Jennifer Heriter, and we stopped and saw Dr. Josh Umber, and Dr. Doug was there that day as well. And it was just a very enlightening experience to have traveled down to those clinics and to sit in their waiting rooms. Some of them see their first clinics. Dr. Lassie has now made a new clinic. But Jack and I, we went to antique stores and we went to clinics, and, we just kind of trekked through Kansas and decided that this would be the new lifestyle. It was exciting from the minute we walked through all of their doors. I then later, the nurse practitioner that started with me, that I kind of lured in, my people that I kind of drove their passion, Melanie Dresden, she rode down there with me. And on the way home, it was really her and I that I was kind of persuading her to jump in with me, try this new line of medicine, and brainstorming names the whole way home, and just really kept focusing on wanting to touch on that integrative, holistic perspective. And I could not get over the fact that my kids love the word human at the time. It just made me glow when I thought of it, because they just thought the word human was so amazing. Like they would say everything about, oh, and you're human. And they loved that word. And we just kept talking and ended up creating this name, Healthy Human. And And as silly as I thought it was for a clinic, because I'm very traditional, pretty conservative person, and I'm like, oh man, Healthy Human's not a name of a family practice clinic. Who people might not even take me seriously, and I cannot tell you that I would want to do medicine any other way without that name. Like that is our name. That is who we are. And it is literally just our daily protocol. That is our mission we live by. And so that's really how we became who we are and how we made our name, and the people that helped own that passion with me. And so it's been really fun. That's been going on since 2017, early 2017. So yeah, that's how we became who we are.
Amber, I want to ask you, how old was Jackson when you guys
Oh,
made
don't
that
make me
trip?
look like a bad mom. I'm trying to think. So that would have been 2017. And so that's what? Oh my goodness. Are you kidding me? 3 years ago, almost to a T. So we would have been 10.
Wow. I love that it's not only, your passion coming to life in a clinic that is now approaching its 3rd anniversary, but also that you're describing family involvement as well. I mean, you took your son with you to see DPCs, and for him to see his mom be an entrepreneur is just so special. And for you to have the support of your husband in those 6 or 7 times that you fought yourself as to whether you should do DPC.
Yeah, and
or
I
not.
might be under exaggerating,
also,
like patients do when they don't tell you how much liquor they consume. I might be under exaggerating how many times he told me to just be quiet already. But the good thing is that he never gave up on me. He just kept listening. So that was good. That's one thing I've noticed along this journey, is between family members and colleagues. It is just a very involved journey, and you do not feel alone, which I feel is very different from what the typical medical system has created, where many physicians do feel like they're isolated on an island.
I want to build on that, given that your youngest Rex is now almost 6 months old. How was your journey in maternity leave as the business owner?
I will touch on that in 1 second. I do want to go back and just, when you commented about how it is truly a family effort and it's become kind of a family passion. And yes, and now Rex is incorporated in that, although I thank you for pointing out, do not even have him on my website. Again, Mom of the Year. I have to get my IT person on that, which I better send a task to myself, because that's me. But I have included everyone, and it's been great, because I have the moments of driving down and embarking on this new entrepreneurial ship, I guess, as entrepreneurship and investigating what DPC is. And then, it wasn't long after that the AAFP DPC summit came around, and Dr. Lassie was giving his talk about, chasing the carrot. And the song that highlights that end of his speech is actually one that Jackson also found, about just loving your career, and every day is a vacation, basically. I mean, it's a great song, and he heard it, I heard it. We knew that, that's the life we lead now as a direct primary care family. But I even remember in the car, we were not able to attend that day that he spoke, but we were on our way to South Dakota for our family vacation. And we literally had him pulled up live, watching him as a family in the car driving to South Dakota. And the kids are all singing because they'd heard the song a million times, because they'd seen me singing to it. So I have Tucker and Hank and Jackson, and my husband's, again, probably eye rolling at us. But it's so neat, because they all are involved in it, and they know how much it means to me, and they know that they see me more. And for some of them, like Tucker and Hank, they don't really know what life was like when I was gone all the time because they were pretty little. But like Jackson understands how much more I'm here. And I think that's really important for people to know that are trying to decide if it's worth it to cut corners or budget all these things out or make this move or don't have a salary anymore. Just do those things we're all very fearful of, because when you see your kids' faces light up like that and you've never experienced that, because that's just not something a lot of us have done. Some of these are our first and only jobs. It's just a really, it's a neat thing to see. And they do drive a lot of your even motivation and passion after you open as well. But as far as Rex, yes, he is our kiddo that I would never say our oops baby, because, oh my gosh, he is our happy, amazing baby. Just love the kid. He was 4 weeks early. Because why not come when your mom is on C-section call and during COVID and there's no plan and it's a Sunday night. There's just so many things that really, there's never an ideal time, but he just kind of presented himself. But I just have to think that we were very blessed with him and getting to do this again, because like I said, we were both very busy with our jobs. My husband's a contractor and owns his own business. And this is kind of our chance to do it over again and do it our way, or DPC style or entrepreneur style. And we've really enjoyed having the freedom to really mix and match our schedules and take care of our family now with a newborn. It's different.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes. As an expectant mom, the idea, I see it now with my son who's going to be 3 in November. You just don't even know who these children are because they grow so quickly. And the idea that you have had your kids see you as a successful woman who has developed her own business, and the fact that you are able to see them more often. That's what I envisioned when my husband and I took a job share in the first place. I'm so glad that you shared that. And that is awesome that you guys have that opportunity. I am so happy for you.
It's been a real blessing. And, I think that physicians, when I say people, obviously females, we're the ones carrying these kids, and we have that motherly instinct to just have all this planned out. So we're not going to be a failure for one, but our kids are taken care of. And, we have so many thoughts going through our head, and then also wanting to run a successful practice. We want to be there for our patients. I think the real thing is you have to really dive down deep into your soul and figure out, one, why did you go and create this practice, or why do you desire to create this practice? Because looking at that is what will help you really design what you're looking for from a maternity leave, from a, pre-maternity leave. What does your return look like? I don't have a lot of things that changed in regards to how I want to practice medicine in my own practice, or how many hours I want to work. Really what changed for me is I just don't have that desire to go back and do any more moonlighting, or yes, I'll moonlight, or what I mean by moonlight is work in the emergency room or work at other locations that are not my own. I love relationships. I love being social. I love learning. So really moonlighting or locums positions, those were never really an extra task per se for me, or a headache, because I've always enjoyed doing those things, and keeping options open, and like I said, learning new models of care. The thing is that DPC, for me, it has just changed who I am and how I see medicine and how I see my family and how I see patient care. But it wasn't like a big shifted change. It's really changed monthly and even daily, and sometimes hourly, depends on my hormones, on how uh, just on how I want to practice, because I would have never thought I'd be that person to say, maybe I don't want to step foot back in the emergency room again, or maybe I don't want to work another overnight shift again. Because as my family's changed, and even as my practice has changed, like every day I wake up just really wanting to be present at my practice even more. And so I guess what I'm saying is that I may want to return in the next month, working 5 days a week at my practice, which may be something I might not have wanted to do before. But now that I really don't want to go work for someone else or work at night, and maybe I want to invest more time into my people or my medical family, for me, 5 days a week or 5 half days a week, that might be okay to me, but it doesn't mean that's okay to you, Marielle. It's all on what our desires are. And I think that's what I see a lot on these DPC pages, and people trying to find, quote unquote, the right answer. There is no right answer, because you are the one that's determining that. And there are a lot of different ways to run your maternity leave. There's a lot of different ways to return from maternity. The only thing I can say for any guidance, since you have to determine that on your own, is that if you believe what you are incorporating, so like, for example, if I truly feel like I'm giving the best of my care possible on X amount of days per week, and I truly am passionate about that, and I am giving my best when I am present, your patients will feel that, and they will understand that as well. And if you set those boundaries, then 3 days, 4 days, 5 days a week, whatever you determine, your patients will be okay with that, because they are there to see you, and they are there to have you as their doctor. And as long as you give them some sort of communication pathway, maybe it's 3 days present in the office and 2 days present on email or telehealth at home, they are there and will stand behind that. For me, I don't like to leave the clinic unattended by at least someone daily to see a patient if they needed an exam in person. We do close on Tuesdays, so I guess the other 4 days. So if I'm not present, like I just went and took a trip this last weekend, I made sure Dr. Halgren was there for at least a couple hours, a couple days that I was out, because I want to make sure I hold up, quote unquote, my end of the deal, and provide good service. But I know probably 90% of those patients would have been fine even doing a telehealth call with me not in the clinic. And COVID's helped that a lot, really transition care and teach people that medicine doesn't always have to be sitting in an exam room, especially for follow-ups. So I think that's what people need to realize, is that you need to determine what it is that you're okay with, because this may be your last chance of doing this, or it may be your first and you're trying to figure it out for the 2 or 3 more kids you have. But I think what you really need to remember is that this is your practice. So the only person that knows the answer is you. And you might have an answer today that's different than 3 weeks from now. But you just have to be very confident in what you're choosing, and your patients will stand behind you as long as you're not pushing and pulling them in too many different directions too often.
I hope that any parents who are out there with young kids or older kids, or those who are planning on having more, really take your words to heart, because that's it goes back to, if you've seen one DPC, you've seen one DPC, but also that everyone who is doing this model, if they are taking something like maternity leave, or if they have to take a leave of absence for whatever reason, that
they
what was I
just
going to say?
they follow the direction they want to go, really. And now I say that with slightly a grain, small grain of salt, because I do I make it sound a little easy. Don't kid yourself. Like, I'm type A OCD. I am a planner. I'm an over planner to the point where, like, my husband taught me, at least 4 to 5 years back, like, Amber, it is okay to have a day on the calendar that doesn't have something penciled in. Like, it is okay. Life will actually maybe even be a little bit better if you have a free day. And I don't know what free days are. For me, I feel better in chaos almost. I'm getting better at that. But I think as residents and being in the medical field, like, we learn to have peace and calm in a crazy world around us and chaos around us. So sometimes it's almost easier for me to be in chaos because I have like a calm about me. But as I got older and I realized that sometimes on my free days, I was just filling it with things because I'm like, oh, I haven't got to do something with this person, and they've told me 800 times they haven't seen me for 6 months, or, and so I'd pencil all this stuff in, and I realized, oh, it might be good for me just to go do something by myself for a couple hours and not have something scheduled. And I think that's also what I have taken into DPC more than anything is, that push of him saying, Amber, you don't always have to have everything scheduled. Well, I still do need probably 80 to 85% of my week scheduled, because if I didn't, then, I probably wouldn't be as productive, for one, because I really work efficiently on a schedule. I also am able to take care of my patients better if I have everything penciled in and I know when I'm doing things. But what it's really allowed me to do is now that I'm in a very good, as far as calm state of mind, and I've performed my self-cares, and I've really got to just focus not only on my family in the last 3 years, but myself, and my health, that I can work and even overschedule myself for a while, but I'm also very much in tune to knowing when, like, I do need that day where it is completely free, or I do need someone to come in and work for me at my own clinic for a day. So again, I can be completely free and tell my patients, hey, I've got to go. This is who I have covering, and having those boundaries are all right. You just have to figure out and perform the self-cares to know, like, what can you handle and what can you not handle? And I think that'll help you also figure out where to come back from maternity leave, like what direction you need to go. And it's okay to start, lightly and ease your way in, or start heavy and pull yourself back. That's really something that DPC allows you to do, because you can see patients from a distance or on an email or, in clinic. You have a lot of different options.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad. When Dr. Hallgren joined the practice, as well as when you decided to open up a second branch, how and when did you plan those?
As much as planning gets you to a really good spot in life. It's also a very well-known fact that, people that plan and schedule and whatnot, they're just more successful individuals as far as from an entrepreneurial perspective. Yeah, that does great things for me. But at some point you do have to let go of the reins a little bit and just let God do his work. Because I did not plan Dr. Halgren. I was blessed with his presence, actually. We became friends before he even had chosen to come do any sort of PRN clinics with us. He actually had moved to town and started a DPC in Omaha, and he was just wanting to meet local DPC physicians. And he has opted out of Medicare and was able to see Medicare patients. And actually, I have just really struggled on, do I stop moonlighting? Do I accept Medicare and opt in or out? What do I want to do on that? And I had convinced myself I was going to start accepting Medicare when I returned from maternity leave. And honestly, with COVID in March and me doing everything from admin to HR to IT to even heck, running the city of Blair crew outside tearing up my concrete today. I got to a point where I was like, Medicare and opting out may not be a great thing to do right when I'm returning from maternity leave. I'm already going to be a little swamped. Adding in something new like that was not what I thought would be ideal. So actually, he is somebody I reached out to just to see, hey, would you want to see Medicare patients for us at our clinic because you're opted out? And we grew this relationship, which then later evolved over the next few months into him saying, actually, I really want to travel. And I don't know if I want to be on 24/7 for a patient panel anymore. And he is now going to be, unfortunately, closing his baby and brainchild at the end of the year, with maybe, in the future intentions to open back up and go a different route. But for right now, what's best for him and his wife is travel and relationship. And he is now going to be helping us and kind of job sharing or co-managing patients with me. And I'm really excited about that, but it is nothing that I planned. I very much planned having Melanie, our nurse practitioner, cover 2 to 3 days a week for me to keep our clinic open while I was on maternity leave. That I planned, that I over and over educated our patients on. But as far as Dr. Halgren, that was just a blessing. He just kind of eased in. I guess I have just a really awesome staff, and they made him feel so welcome that he couldn't turn it down.
And what about opening your second location in Ashland?
Emily, my LPN that opened the clinic with me in 2018, I'm going to throw her right under that moving bus because we were open just for just a few months in 2018. And and her and I, as usual, I'm standing out in the front lobby having a cup of coffee, one of many for the day. And I'm talking to her and she's trying to work, but I won't let her because I'm still talking. And her and I start chatting about how I went to Ashland to visit some family. And Jeremy and I were driving down this sweet little main street that's all brick and, just all those feelings you get when you're back in your hometown and nostalgia. And I just said, hey, if there was ever something for rent down here or lease, what do you think about having a practice down here? And Jeremy's looking at me cross-eyed because he knows he's the contractor and like, lady, you're going to kill me if I have to rebuild another, clinic site. But he went along with my crazy idea and he's like, we could do it. We could do it. So I bring this back to Emily, and don't ever tell Emily something unless you are like ready for it to happen. Cause she's like, I think it's a great idea and we should do it. And I'm like, oh, Emily, you know that I can't do this alone. Like I'm going to need you to help me if we're going to open this. And she's like, yeah, we can do it. And it's going to go great. And the people of Ashland are going to love it because this is an amazing model. And every day is like Christmas because we get meds dropped off that are super cheap and I get to tell people about how awesome this is and we got this. And, she is just so darn convincing that I walked out of there that day like we got this. And we apparently must have pulled everything together well, because by February of 19, less than a year later, we were opening in Ashland a year after we'd opened in Blair. And it wasn't, knock on wood, as bad as I thought. It's really that build out and getting everything prepared. But once you've opened one and you're able to kind of co-share the inventory and even, the staff helping me co-manage both locations, it actually went a little bit more slick than I thought it would.
And you're using Atlas to manage both locations, correct?
For me, like I said earlier, relationships are everything. Like, I am that curious cat that, like, if you can stand there and endure my question after question of why you choose what you choose, or why you're doing what you're doing, or why your product is amazing, if you can get through my litany of questions, and it's not me interrogating and being a jerk. It's just, that's how my brain functions. I have to know all the answers, and then I will make a decision pretty quickly on, like, is this the right thing for me and whoever else it's going to impact? And for me, Josh and his family, they sell that product well. And I don't mean that from like, hey, he's a salesman. More like they have a passion for their product. And that's why Healthy Human does well, because we have a passion for our product, which is, creating healthy humans. And so when he truly sat down and he just navigated through his EMR, as I'm seeing his clinic, and he's just making a doctor's life look pretty darn simple, going through that EMR after, navigating through Epic and many other EMRs in the 10 years I'd been practicing. I not only loved it for that reason, that it was simple. Yes, it didn't have all the bells and whistles, but I needed simple. That's what my brain wanted to function on. The other thing is that I was overwhelmed by password fatigue, and I just really didn't want to log into multiple different things and have kind of a clunky unit. For me, it made sense that I could have a pharmacy in there, I could bill in there, I could text from in there, I could email. So for me, that's how my brain works. It's kind of like picking up an Android or an iPhone. Like, if I picked up an Android or went back to Microsoft, I don't think I could do it anymore. Yes, I was raised on Microsoft Office and Word, but like, I'm an Apple person now, and that's how my brain functions. So when I look at Atlas, like, it just makes sense. And so to me, I thought Atlas was great from the beginning. And then even when I talked to Kirk, his brother, and tried to figure out, now, how do I incorporate a second site? It was like, oh, really? That's all I do? Like, I just push a add button and I add my site, and then I can function it from one page pretty much. Yep. That's pretty much it. Okay. Yeah. Sold, so, I just love it, because that's another reason why I was able to open up my second location with ease, is because my EMR works for my brain and how I need to manage my staff.
Do you travel between clinics?
God bless all the Ashland patients, because, they already have kind of a trying state of care. I guess that's what I should call it in that town. That's if it was just any town, I would not have opened a second location. Like, there really is no point of me leaving a very busy practice at my prior location to open a clinic and then add another clinic. Like, that really defeats the purpose of me trying to slow down and be with my family. But Ashland just really tugs at my heartstrings, because I grew up there. I was shuttled into Omaha to have one of the best family practice doctors in the state of Nebraska. He was actually one of the family physicians of the year. So I loved his care. And my mom truly believed that guy walked on water. But I really wish, as much as I love rural family practice, like, I really wish I could have had care in my hometown. There was a medical clinic there. I wish other people could continue to have care in their hometown and experience what rural family practice is like, because it's taking you and moving you far back in time. And I just think anything vintage is really unique. I'm a huge history person. And so for me, I wanted to bring back that chance for people to have care locally. The clinic there has been owned and operated by multiple different entities over the last 20 years. And even after I established care there, their current clinic that was open closed within a year of me being open. So they were going through another medical transition. So as much as that's kind of a bummer for them, I mean, I hate to say it, but it does give us a little chance to make mistakes and feel out what does the town of Ashland need. And I really would give that as advice that wherever you're going, you might just have to feel out, like, what do you think is acceptable as a practice? And what does the actual community you're serving need? Like for them, there's certain times of day, it's a bedroom community. So certain times of day is the time they're available. Well, some of those times of day, we can't accommodate because then we'd be gone from our own families around the clock. So what we've learned as we've tried to move times that were open and days that were open is that it's not really even about the time or the day in Ashland. It's really about just being available when they need you. And a lot of times, since they're not used to having a practice there that's ever stayed open, they can even manage with telehealth visits a lot more so than what Blair does. Blair's kind of a town that's used to seeing me in person. In Ashland, I do a lot of telehealth. I do all my initial visits in person because I truly believe you have to lay your hands on an individual, do a full physical exam, see what their baseline is. But a lot of things after that can be telehealth. And so we really utilize that for Ashland. And then I make sure whoever I have being my nurse or I did have a medical assistant that went out there for the first year or so we were open. I just made sure that they were willing to do some traveling back and forth between clinics. So if somebody in Ashland did need something and I couldn't be the one to accommodate them, that they were able to say, go out there and give them their medicine or give them an IV started or give them, something for a migraine, whatever my clinic would be willing to do if I couldn't be the one to do it. And nothing that would sacrifice our culture or sacrifice patient care, but something that was all within our means. So currently I travel out there on Tuesdays, and we've been slowly adding in some hours on Thursdays. And as we're able to get, if Dr. Halgren's able to pick up more days or we're able to get another full-time provider, we'll be open there more often. But we just really try not to bite off more than we can chew in that second site. And again, like I said, they're a site that they're not used to even having anybody available for care. So they're willing to accept what we can offer.
For me, it definitely hits home because my husband and I both trained in Superior, Nebraska, and the physicians who were our attendings when we were in training, Dr. Tim Blakey, Dr. Leibel, and Dr. Tice, they go to Hebron, they go to Deschler, and they drive, that's part of their routine during the week. They each cover clinics, nursing home care at different locations separate from Superior. And this goes back to, what you were saying in terms of even on maternity leave or just opening a clinic in a different town, when the people who are your patients understand that you are there for them and you're there to help make them healthy humans, they definitely, I can see them understanding care on a different level than if a corporation came in whose goal or whose vision might state that they have the patient in mind, but we all know that that's not always the case. And so, that's great that you're exploring what will work for the community as you grow. But I totally understand that because I've seen that model work in the state of Nebraska. And work well for patients who don't have access to care in their town. I want to highlight the uniqueness of your practice in that you do offer IV offerings as well as hormones and aesthetics. Can you touch on the services that you offer?
I always kind of laugh because I tell people there's a better chance that we do something that you're kind of rattling around in your brain, then that we don't offer it, because I truly was trained in like full-fledged family practice from birth to grave, everything. About the only thing I don't do is vasectomies, which Dr. Halgren does. So that works out perfect. And I would much rather deliver a baby than do a colonoscopy. So I did all my training in OB and C-section care. But about everything else, that you would be going to see a specialist for, we are doing it at our location, which helps us keep a lot of care local and they don't have to drive out of town. But it also, again, starts to really remind or re-educate people of what family practice used to be to people before everything started to branch off into specialties and subspecialties. We were all trained, and people before us, to do all these things without sending someone down the road to ortho for a knee injection or to a dermatologist for a skin exam. Now, I'm not undermining them and saying that their physician specialties are not worthwhile and that I'm, do a better job. I'm just saying that there is a reality there that you're talking small towns all over the United States have patients going without any health care in any of those areas because physician specialists can't find the time to get out to those locations. And it's not that we're trying to take over someone's job. It's just we're trying to provide a service that otherwise these people would not have. So there are times where I still send someone to a dermatologist. Like I had someone not long ago that had squamous cell and they needed a Mohs procedure. Great timing for me to use a dermatologist or a plastic surgeon. I have people that need colonoscopies. Great. I send them down the road to GI. I have people that need surgery, and I have to explain to people all the time that I know you love me and you want me to do everything for you, but I cannot do your bladder sling. Appreciate you wanting me to do that in my clinic down the road, but I do have to refer you off for this one. So I have to laugh because Jackson, my oldest, he likes to tell everybody at school that, where my mom works at her hospital, and I have to remind him that it's a clinic. It's not a hospital. He's like, well, you deliver babies over there. I'm like, no, honey, that's what I do at the hospital. And he's like, okay, so you don't do all that at your hospital? I'm like, honey, it is a clinic. It is not a hospital. So I have to laugh because it's the patients and my own child that get confused of where, do I draw the line? And I truly enjoy having new innovative offerings. So again, I can have people that are used to traditional care, like, hey, let's do a steroid injection in your knee or shoulder after an injury, to, hey, if you do not want to have steroids injected into your body and you want to try and let your body do its own work and its own healing process, we could do a steroid injection if you want, or we could do a platelet-rich plasma injection, which your body is going to kind of team up all those growth factors and do all the healing itself. So we love to give offer options. Like that is truly one of the things that is important in any part of my medical care, is that I try not to give people too many options and overwhelm them. But I do think it's important to let them know that there isn't one way and that we need to decide as a unit what's the best care for them at this moment. And so that's why we bring in a lot of our options. So we're able to give them that option and also to give them that option to do it there locally. Or if they want to use their insurance or go somewhere else, we can send them down the road to do that as well. So we offer anything from your traditional family practice to, skin checks, biopsies, toenail removals. We do joint injections. I do a lot of women's health. So I do IUD placements, removals, Nexplanons. We just added LEAP because we had a Bilby-Cautery unit and we were able to get our smoke evacuator not long ago. So I'd been doing LEAPs for 10 years at my prior practice as well as in residency. So I was excited to be able to afford a unit to bring that in and do that as a cash pay option, because there really is not more than one possible other location in this area that does a LEAP for a reasonable price. So we're able to offer that. We do colposcopies, and we offer at the hospital, I'll still do vaginal and C-section deliveries. I offer endometrial ablations, NovaSure ablations. And then we added Botox and filler into our practice, so that's been fun. We do a few hormone pellet therapy here and there, and that is really, I say here and there because really pellet therapy is not an ideal treatment plan for everyone. It's very few or select individuals that's for in my eyes. And so we don't have a large practice of that, but we do offer it as an option. We do vitamin IVs for our immune patients. We have a lot of autoimmune disease at our practice and allergy patients. So we do vitamin C IVs. We also do like Myers cocktails. We also offer allergy testing and allergy treatment. You name it, girl. I think we have it. And I recently added shockwave therapy because we were able to buy a shockwave unit from a place that Melanie, our NP, used to work for. So we've been able to add that in as well from like a physical therapy standpoint for those people that want to avoid, again, getting steroids for like an epidural injection for lumbar radiculopathy and whatnot. We're able to now do shockwave therapy so they can try a different modality that's non-invasive before they make that next step up. So we just have a lot going on. I just want to say one thing about hormones because a lot of people do almost like an eye roll when they think of hormone therapy. And it's really funny how our practice really became so unique because it really got to a point where I was practicing more osteopathic holistic medicine and even more non-traditional, like really treating a lot of people from an allergy and hormone standpoint at my old practice that it became almost a burden when I would leave town because then my poor partners would get these people that they'd be like, well, I don't do anything like this. So, what do you want me to do with them while you're gone? And I don't mean that like they couldn't handle it. It's just that once you start practicing like that, it's just a different frame of mind. And really, a lot of that was driven because I had quite a few patients about 7 years ago that were ending up on my doorstep with pellets inserted into them, and they were having a lot of side effects from the very overwhelmingly too high hormone levels that they were causing. And so they were coming to me as their family practitioner to help them really figure out what they could do to manage all these side effects and adverse reactions. And instead of really bad mouthing anyone or saying, hey, you as a patient shouldn't have done this, or, wherever you went shouldn't have done this to you, I just took that opportunity to educate myself on BHRT and pellets and why people would do it and how they do it. And maybe is there a right way to offer it and not necessarily always a wrong way? And when I went and did that extra training and really was mindfully aware of what the patient side was and the practitioner side was, that is where we really navigated and started moving towards a lot of hormone therapy, more so because I saw so many people doing it the wrong way from a practitioner standpoint and putting a lot of these patients at risk. And I just wanted to be the change in that movement to help people get hormone therapy without risking their lives with clotting and cancer and even getting false information. And so I truly enjoy helping people receive hormone therapy on a very safe level. And that's exciting.
I have become a huge fan of podcasts. Ever since Sarah Koenig hosted the first season of Serial, I was hooked. Now, creating this podcast has become part of my daily life. While it is an exciting new hobby, I also see it as a privilege that I get to interview so many DPC and direct care doctors. If you are interested in starting a podcast, let me tell you a little bit about Anchor. First of all, it's free. There are creation tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, and many more. You can make money from your podcast as well with no minimum listenership. It's basically everything you need to make a podcast all in one place. Download the free Anchor app or go to anchor.fm to get started. How do non-members benefit from your services?
I do understand where a lot of these DPCs really push member services only. And I get it. I understand why we want to have value in a membership. And I really do. I have boundaries on things that I allow and don't allow for members, non-members. I also have things that, if people choose not to be a member with us anymore, I also have boundaries on that, because you really need to realize, if you're choosing to leave the practice, you're giving up all of these, I guess, complimentary things that we've offered to you all this time. And this is this is the practice you're leaving, and you're going back out to that traditional world. So we have a lot of boundaries on those things, so people understand why a membership is so valuable. But let's face it, right? Everybody does life their own way. You do you, boo, right? You have to go with how people rock their world and how you can impact them the most. And what was happening is there's some people that really did not want to be members. It's not because they didn't like me. It's not because they didn't like my staff. It's not because they didn't like DPC. It's just in their mind, membership did not make sense. It is not what they felt comfortable with. They didn't want to spend their money that way. And some of these people had a lot of money. Some of these people had no money. And what happened with the people that really didn't have any money, or maybe they were somebody that owned a business and didn't have any health insurance or whatever it may be, I know that I could have said, well, I guess too bad for them, because I have a membership-based practice, and that is what I want people to realize, and they either are in or out. I didn't want to do that. I had started that way. And then about 11 or so, almost a year in, I started realizing that the people that didn't want to be in a membership model, some of them, it was trust issues. Some of them maybe just didn't even know if they liked me. Maybe they didn't know if they liked paying cash over their insurance, whatever it was. And I thought, I'm really not following my mission. My mission was to provide healthcare for people that need it, so they did not have to go without annual exams for 5 years. They didn't have to wait 7 months to have a rash seen. Like, if people are really picking and choosing if they care for themselves based off if I'm going to offer a membership or a fee for service option, like, I would much rather know that I did what I said I was going to do. I was going to offer healthcare to people that couldn't afford it, or, they were limited in some way. But I also have to do it on terms that would bring value to my patients and even put boundaries on myself. And so what we do is we do allow people now to do fee for service. I do not charge an escalated amount. I know some DPCs really put a high dollar price on those. I guess I could. My thing is that usually what happens is when a patient comes in and they see our service, they see what it's like there, we build that trust, and they also know that they have health conditions that they would be able to talk to me around the clock about and not have to always be billed for a visit. They see the value once they're there, and they know that that is what they want to do. And for those that don't, that's fine. They just have to wait until I have a window of time that's available. And that may be 2 weeks down the road or 3 weeks down the road, because they can't have my same or next day appointments for my patients that are paying as a monthly member. But they are still given the opportunity to see us. They just have to wait a little bit longer or take the appointments that are offered, right? So that is how we run the ship on that. I'm not saying that everybody agrees with that, because they don't believe that's the DPC way. But for me, that's the healthy human and DPC way for me. That's the mission that I wake up every day happy that I'm impacting my small communities, because I'm not excluding people.
What is if you don't mind sharing, what's your total population right now?
Now, remember, we do a lot of Botox, so it's not just like a family practice visit, but we have about 200 people in our system that aren't members that are using us for something, maybe IV therapy or Botox, or they wanted a rash looked at, or we've had people that even come in and just get suture care because they have an incision and they don't want to go to the ER. Some of those people in our system also might have had rapid COVID tests, so there is a lot of different things that could be, but we kind of ebb and flow around like 500 members between me and my other providers. So how does that impact us? Well, it just depends because it depends on where you're at. Right now, we've been open almost 3 years. And so I don't have a lot of new patients as far as new members. And for me, once I get through that like introductory phase of patients coming in, things get a little bit more manageable for me. But since I do almost like a specialist type workup because I do a lot of integrative care and hormones and really finding the root cause of people's issues, I'm getting a lot of people that, they've been sick for a long time and they've just now saved the money to join, or they've just now decided they're finally going to leap and come to a direct primary care versus an insurance model. So I have like paperwork, and records and labs and things that I have to go through when I have a new patient, because I'm almost like house. I'm investigating all of these people's complaints that have been going on a long time. And we have a lot of autoimmune patients, like I said, and allergy patients. And there's a lot of work and labs that are involved with that. But for some people, that would make them run and they would probably scream and drink a lot of wine at the end of the day. For me, that is like that's what drives me. I really enjoy investigation. I really enjoy helping people that feel like they don't have any choices left and that they've went everywhere and no one's given them any hope, and we're able to give them answers. I really enjoy a complex patient. As funny as that may sound, it actually it is so fulfilling to watch somebody go from who they are when they walk through our doors, and 6 months later they are a completely different person. And we incorporate a lot of counseling with our program, so it's not just me doing all this work. It's my nurses, it's me, it's our counselor, it's when we do nutrition, because we offer nutrition as well. So we truly are trying to make healthy humans from the inside out.
And you guys as a team are not even just taking care of your patients, you're also taking care of each other. And I want to highlight that as well. How do you take care of your own?
We incorporated rapid COVID tests 3 weeks ago, and I'm not kidding. We've probably talked multiple times each of those 3 weeks on how can we improve this process? How can we reduce burnout for our nursing staff that's running out there and doing this drive up testing? Do we want to consider even shutting it down and stopping it? Because we don't want to impact anybody poorly from like a burnout standpoint or our current members. But we have agreed together on most any topic, that is controversial. We sit down and we talk through it. We probably don't have as many staff meetings as some. I was at our mastermind not too long ago in KC, and I know Dr. Vanneman does a great job. And probably, I think Dr. Herder, I think she said they have them too, but they do a good job on staff meetings. We've really just started incorporating those, but I think that we talk so freely amongst us in the clinic that we don't always have to have a staff meeting. But that is where our culture lies, is we just have to be very as transparent as we are with our patients. We have to be that transparent with each other, because to me, turnover does not help me any. At the end of the day, it's me I would have to teach new people how we do what we do. It would impact our patients. I want to make sure the people that work for us are happy, so they stay there. And they stay there and they're happy, because it does not do anybody any good to have somebody be miserable in their job, right? Then it's almost better that they go. But the point is to just be very transparent and figure out what is it that's not working for you, and can it be changed, and how can we work together to help you stand on your 2 feet. So we just really encourage and coach each other. And I'm very blessed with the people that work with me, because they are also passionate about what we do. And that changes things, right? You have to have a little skin in the game to offer quality service.
And what type of benefits do you offer your employees?
I don't offer health insurance right now, just because, we're a cash pay model that doesn't use health insurance a whole lot. But it's not that I don't believe in it. We use health sharing for our own family. It's just a lot of the people that I had hired on hadn't necessarily needed it at the time, but things like that I hope to offer in the future, like 401ks, insurance if it's needed, traditional benefits that people typically get. But I like to do things too that most places don't offer. Like when I had a job, I didn't necessarily get free scrubs. And so I give my staff 1 to 2 pairs of scrubs a year because that's what they have to wear to work anyways. I offer them some way to be well, may that be from a mental standpoint or from a physical, so they, can use Anytime Fitness or the YMCA. We can get them memberships there. They can have a zoo membership for their family at the Omaha Zoo. And we give them, paid holidays off. And what else do we do? I give them anything supplements or skincare products for 40% Botox at cost. I just try and make it worth their time to not only come to work every day, but also to support us even out in the community and let them know that what we do is the real deal and they're proud of where they work. So we offer a little bit of everything. I offer discounts for, if they become pregnant and they want to use our prenatal services, any of the ways that I can, again, make their job more fun. It may be a very non-traditional benefit, but it's a benefit nonetheless.
I would join you just for the Omaha Zoo membership. Great. That's my favorite zoo in the entire world. So I'm biased. When you mention the things like discounts on aesthetic packages, I want to ask you, how do you decide what products to offer?
I am a very simple person because I want to make it easy to kind of even understand why we do what we do and how we come to conclusions. And so for me, like, I want a quality product that's going to give me the results so I don't have to have multiple in the office and a ton of inventory sitting there. And so when we picked a supplement company, I literally just called multiple companies that I had heard good things about, and I had their reps come and sit down, and I just questioned the heck out of them and made sure I knew that I could back the supplement, the company that I chose and why I chose them. And for me, Metagenics was the ideal supplement company. I do use some orthomolecular and randomly here and there, like literally maybe once or twice a year, I'll order 1 or 2 Thorne products. But I am a Metagenics person and orthomolecular through and through. And for me, Metagenics was my go-to because they could show me the studies to prove that their products worked. And that's something that, a lot of over-the-counter supplements can't do. And, obviously they could be sending me some biased study or whatever may be, but they sold their product well. It looks nice. I like the aesthetic look of it. And when I started incorporating it in compared to like actual pharmaceutical supplement type, like vitamin D and whatnot, that I had been using for years because I couldn't bring a supplement into my old practice, I was watching people's labs turn around within like 4 to 8 weeks max. And to me, that's a quality product. Now, some of that is all the other stuff I'm incorporating to make that product work better. But when I can show a patient, like, here's your labs with all of this 20 bag of supplements you just brought in and you told me you're taking, and your labs are still really low, and here's what they look like now after 8 weeks of being on our Metagenics products, that answers everything for me. And it also answers it for the patient. And they can tell the difference in the quality of product. So that's how I picked Metagenics. Revision Skincare is top of the line. Again, aesthetically, their bottles, everything, they look nice. My rep's awesome. And their products really work amazing. Obagi does too, which is another one I use. And what I just do is I offer both lines, and really it's because they offer 2 different price points. So then we can give somebody something that maybe can't afford that top product like a Revision, but they still want a great outcome. And Obagi can do that along with how Revision works too. It just is a little bit more affordable. And then from a aesthetic standpoint, as far as injectables, there's a lot of people that offer all different types of injectables, anywhere from Galderma to Mertz to Allergan, they offer them all. For me, I wanted one rep. I wanted one product. I didn't want to sit there and educate people on all these different ones and which one you could choose. Because honestly, if I have good results with Botox from Allergan and it works well and I know what that's going to provide for a patient, I'd much rather just say, this is what we offer. And if you want something different, you're more than welcome to go somewhere else. But we know what Botox will offer for you, how the outcome will be, and we're that kind of people. We're just very loyal to who helps us for a service, and so having one or two choices only just makes sense to who we really are as a clinic.
Are there any other tech or tools that you recommend?
I love our shockwave therapy. We just had somebody just the other day that started a couple sessions for her lumbar radiculopathy, and I am not joking you. She already is like moving on to a different part of her body because her radiculopathy is gone. And we're talking about somebody that was going to go pay money for an MRI and then possibly go for a steroid injection. So that's where the money's at. That for me that's an awesome outcome. And then I love our INSO kits from INSO Doctors. That's our PRP kits. It's not necessarily a tech tool, but it is a newer package item for us. And we really enjoy that because it gives us another option to use from an integrative standpoint. I love our LEAP machine because I don't have to send everybody out. Now that I've done, the colposcopies, I can also follow it up with the LEAP if we need to. And again, we did that at my old practice, but with the new PAP guidelines, it was just not something we used very often anymore because not everybody would get to an actual LEAP procedure. But now that we've been in practice long enough, we've got a few PAPs that they're advancing towards LEAP. So it's nice to be able to offer that option. And then for other Midwest doctors to be able to send people to us if they need to for a cash pay option. And then gotta love our Butterfly IQ because we can use that for bedside OB ultrasounds. So that's some of the techie stuff we use, and I love it.
In terms of, you have already mentioned challenges that you've overcome. Are there any other challenges that you like to highlight or celebrate?
People need to realize that you are going to have challenges. It's not if, it's when are you going to have them, and really just learning to go with the flow of that. Sleep on it if you have to. Don't decide right in the moment. But I mean, at the end of the day, people are looking at you to make that decision. We were laughing today because, no joke, in the almost 3 years we've been open, we have had a day that our electricity has been out. There's been a day that our water has been turned off because somebody hit a water line, which was today. And, our phone lines have been down. You name it. We have had it happen. And we were kind of laughing about it instead of freaking out because you're going to have days like that and you're going to have to improvise. And that's where having that key staff with you that can also improvise is huge. So those are challenges that as an owner, you're going to have to deal with. So here you are, you're a doctor. That's what you've been trained to do. That's what you know how to do. But you are going to have to, unless you're going to spend loads of money, you're going to have to know how to do marketing and IT and quality and customer service and be that HR person, unless you're going to delegate all those things. And there may be a point where you're big enough that you're able to, but with delegation of some of that stuff, you also lose a little bit of you and a little bit of how that practice is what you've made it. And so that's a very fine line. So you don't steer away from your original missions and goals. But I think everybody will notice that when they get into this, it's hard to be a boss and a physician because you want to do what's right for your staff. You want to do what's right for your patients. And that's a lot to take on. But I mean, other challenges, just trying to decide what kind of things you do want to have for services at your practice. And if you do want to take that all on, or if you want to refer out. There is no wrong answer. But for me, the model I wanted to create was that people could feel comfortable coming to us with any part of their health care that they need. Obviously, I can't do anything if you're having a heart attack or you need your appendix out, but within reason, we hope you're able to bring stuff to us. But those are some of the things that come to the top of my mind.
It's very relatable to hear that, whether you're just starting out or even whether you're in DPC already. I want to ask if you have any particular resources that you found helpful, in addition to what you've mentioned when you were starting out, or resources that you found helpful since opening.
I'm always just looking for new CME and ways to learn, and PRP, adding things in like that, and just utilizing resources to educate yourself. Anything from like INSO doctors to taking courses. I did a lot of A4M, anti-aging regenerative medicine conferences. I just do a lot of self-education and teaching and CME. And I encourage people to do that, because if you're wanting to add things to your practice, you really have to own it and make it yours. When we added IVs, there's a lot of patients there's a lot of practices and physicians and mid-levels that offer these services already, but you have to do what you're comfortable with, because at the end of the day, it's your malpractice and your liability. And I wanted to add those services, but with a little touch of my style and what I'm comfortable with. And so we just incorporated forms and questionnaires and certain protocols on how we see those patients that we feel does not put the patient at risk and is not too down the line of almost quackery or integrative care that's gone wild. We do a very conservative approach introduced with our family practice model. And for us, that works, but everybody does everything a little bit differently. So just remember that when you do these CME courses or you learn protocols from other people, like, you make it what you're comfortable with and what you can sleep with at the end of the day, because it's all under your malpractice when it's all said and done.
What is the best way for others to reach out to you?
I am available probably by email the most, because just like anybody, I have a little bit of that fear of residency when your pager would go off all day long. I feel that way on texting sometimes. So although text sometimes is easier, I like to start with email, and then we can pick a time for a phone call or a text if we need to. But email is less intrusive to my day. I can get to it when I'm available.
Perfect. And we'll include your email in the accompanying blog post that goes up with your podcast. Thank you so much, Dr. B, for joining us today.
Yeah, you are very welcome. I really want to encourage people to make this their own. Anywhere from not getting overwhelmed day to day, and just remember why you're doing this, because I know you had wanted to say, or had asked, what are some of my favorite DPC moments? And I think that's what you have to look at when you're trying to plan this all out. Like, what at the end of the day is going to make this all worth it to you? And I have a couple of moments in my mind that are literally just 2 different times I was able to stop with a patient and either give them a result of, that their CT scan showed lung cancer, and sit with that patient and their family and answer those questions, to being able to literally pray with someone because their mother was on hospice and they were having a hard time getting through their day. And then within a couple hours of that time we had together, their mother had passed. And I would have never had times like that in my old model of care. And so even when you get bogged down in all these questions and answers, and how do I do this and how do I run this, like, it really does come down to the simple things. Like, the patients are there for those moments, not really caring on what benefits you offer, your staff, or if you did your protocol right, or if you, had your water turned off because the water main line went down for a couple hours. They are there to have you help them get through their hardest parts of what they're going through right now. And you really need to enjoy that, because time goes by really quick, and we are all doing this for those moments. So just remember that when you're trying to think about all these things to do and check off and to get ready for this big life-defining change, right?
Sage advice. Absolutely sage advice.
Yeah. I appreciate the time, Marielle. Always fun. Cala, Nebraska, all the way.
Next week, look forward to hearing from Dr. Dipti Munkoor of My Happy Doctor. Until then, this is Marielle Conception. For more information on this episode and much more, please visit mydpcstory.com.